thank you so much for having me today. It's an honor to be here. I have to thank Dr. Fredrickson for the invitation to present. As Dirk mentioned, I'm an assistant professor at the University of Wisconsin in Madison. My tenure home is in the Department of Medicine, the Division of Geriatrics and Gerontology, but I also hold affiliate faculty positions in the Department of Surgery, as well as the Department of Communication Sciences and Disorders. I also direct the Swallowing and Salivary Bioscience Laboratory at the Madison VA Hospital. So most of my research has been focused in dysphagia, but I'm going to talk to you today about another line of work that I'm very passionate about. So we'll be discussing the potential influence of implicit gender bias on faculty advancement in communication sciences and disorders. I have no relevant financial or non-financial disclosures. So many of you may be sitting here wondering, why is this even something that we're talking about? The field of communication sciences and disorders is 96% female. And in this graph here, you can see on the y-axis, the years from 2006 to 2016. On the x-axis, the percentage of males and females in the field, and then in blue you'll see the percentage of women in the field, and in green the percentage of men. So actually the percentage of men is decreasing in our field over time. So predominantly women. Why is this of concern? Well, when we actually delved into the data, looking at the number of men who go on to receive doctoral degrees, and we're talking specifically here about research doctoral degrees, not clinical doctorates. We haven't really been able to delve into that research at the same level, but specifically research doctoral degrees, you can see that for women, while the percentages are very high in terms of predominance in the field, the percentages who go on to pursue research doctorates is lower compared to the overall percentage in the field. But in contrast, when we look at the percentage of men being quite small, between 5 and 6%, the percentage of men who go on to pursue research doctoral degrees is disproportionately higher. So you might say, well, that's interesting as a fact, but maybe not creating any issues that we really need to be worried about. Well, the first problem that we have to consider is that we do have a faculty shortage in our field. And this was first highlighted by the Council of Academic Programs in Communication Sciences and Disorders. And then in a response to that, the American Speech Language Hearing Association developed a joint committee to look at this issue. And they put out a statement in 2002 and then renewed that joint ad hoc committee in 2008 and put out another statement discussing the faculty shortage, the projections of this shortage, and then also potential strategies that can be used and implemented by ASHA to address the shortage. So if we look in this graph on the y-axis, this is the projected faculty shortage, and on the x-axis, the years from 2009 to 2016. You can see with the white line, with the projections of faculty shortage over the years, that this has just continued to increase. So we've had a higher and higher number of open faculty positions in the field. If we were to increase the number of females in our field going on to pursue research doctoral training just by 10%, you can see the orange line represents what would happen to this trajectory in terms of faculty shortage. So just by increasing female PhDs, we would be able to essentially eliminate the faculty shortage over time. It would take a 30% increase in the number of male PhDs to accomplish the same goal. Our second problem relates to this idea of faculty advancement within the field of communication sciences. So this graph on the y-axis shows you the number of awards, and on the x-axis the decades from the 1940s through the 2010 decade. And this is representing the distribution of the honors of the association. So the American Speech Language Hearing Association gives out a certain number of honors awards each year. These are considered to be the most prestigious, the highest level of an award given by ASHA. And you can see the green represents the number of men who've received ASHA honors over the years, and the blue represents the number of women. So you can see that it's been lower over the years. We're excited to see this switch more recently to more women, but if you look at the percentage, it's still 32% men receiving it. So this still creates an issue in terms of that being a disproportionate number receiving ASHA honors relative to the number of men in the field. Another thing that we can look at in terms of faculty advancement has to do with the number of women and men at each faculty rank. So if we look at the assistant professor rank, you'll see the number of women in blue. On the y-axis is the percentages, and then on the x-axis, the different faculty ranks, assistant, associate, full, and then we also looked at the number that were tenured. And then in green, you'll see the number of men. So at assistant professor, we actually have more women at that rank. Associate professor, fairly even, but then you start to see this switch at full professor where we have more men, and there are more men that are tenured as well. So then we also wanted to look at leadership in terms of department chair positions. So we went through the listing of all of the communication sciences and disorders departments in the U.S. News and World Report ranking list. And this may not be entirely comprehensive, but of that list, we were able either through internet searching or just calling the department to find out the gender of the department chairs. And we found that 71% were women, which we would expect considering the composition of the field, but 29% were men, which again is a disproportionately higher percentage than we would expect when we look at the 5 to 6% men in the field. And then the third problem that we have to consider is the potential for a salary gap based on gender. So in this graph on the y-axis, you can see the yearly annual income. On the x-axis, the different professor ranks. So again, assistant, associate, full, and then across all ranks. So at the assistant professor level, not much of a difference in terms of yearly income. At associate, again, fairly similar. But when we look at full professor, we start to see higher salary for male faculty at the full professor level. And then due to that difference, and the difference is about $11,000, so the yearly income for men is $11,000 higher, and this is a statistically significant difference. And when we look across all ranks, with this being driven by the difference at the full professor level, we do see a statistically significant difference in salary between the male and female professors. So based on these issues that we were able to identify by looking at the data, we thought this was an important thing to delve into. And you might also be wondering, why would a dysphagia researcher have an interest in this? So as part of my fellowship training at the University of Wisconsin, I've worked with a researcher who focuses most of her research on implicit gender bias in academic medicine. Her name is Molly Carnes, and she's a co-author on this paper. And she actually has a course where she teaches women about leadership in the field of academic medicine. And so as I was in that course and kind of learning about all of these potential influences of implicit gender bias, it made me start to think, well, could this potentially apply to our field, and led us to look at the data. So with that, I'm going to lead into a discussion of implicit bias and kind of go through some of the different concepts that relate to this, and build an argument that these biases may be underlying some of these discrepancies that we're seeing between male and female faculty. So I'm going to start, and it's okay if you just kind of shout out. When I tell you that I live in Wisconsin, what are some things that just quickly come to mind? Cold, okay. Cheese, okay. Anything else? Cows, okay. The Packers, yep. Anything else? Okay. Yeah, absolutely. So here you can see most of those things represented. I didn't hear beer or brats, but those are big ones. So you can see that when I just give you that prompt, I'm from Wisconsin, you immediately have things that you associate with that, right? They just come out right away, and you assume that I love beer and cheese curds, which I do, but that's a different conversation. So what do we mean by the term implicit bias? Well, I think it's really important to understand, this is just a key concept, I think, that can be misconceived if we don't make it really clear at the outset. Implicit bias is largely subconscious. So it's not something that we're sort of choosing to have these biases, but we can think of them as habits of mind, unwitting and unintentional discrimination that arises from just the existence of cultural stereotypes. So you might say, why would we all have these biases? Well, it's due to our common socialization experiences. So this is going to be present in everyone regardless of gender. So I think that's a really important piece, because we certainly wouldn't want to have there be a perception that this is something, when we see these sort of limitations to female faculty advancing, that that's due in some way to decision making from male faculty, especially when you look at the makeup of our field. There clearly needs to be biases operating for women as well. So it really is, regardless of gender, something that we all deal with. So I wanted just to kind of prove this point in terms of common socialization. I did a Google search. I looked up toys for girls and toys for boys just to see what kind of popped up on Google. And when I Googled toys for girls, these are some of the images that came up immediately, right? So we have a little girl playing with a kitchen set, preparing a meal, and then a little girl with a stroller, and everything is pink. So right there you can see, in contrast to the boys, an army set and a set of trucks. So from a very, very young age, we're sort of instilling these messages in children that there is this sort of alignment with different social roles, and even to the extent that a color can be associated more with a gender. So starting very early and very common across our cultures. So why do we have these sort of associations for men and women? Well, there's a theory developed by Alice Eagley called the social role theory that's based in this historical division of labor that existed between men and women. So typically women have been thought of, and this arose in the 1940s, 1950s, this sort of division of labor. So here you can see a sort of classic 1950s image of a woman in the kitchen preparing a meal with an apron. And these roles that women and men took in society caused there to be certain qualities that would be attached more with females than with males. So in the case of women, we can think of these things as being communal. So some adjectives that you may hear regularly: nurturing, relational, emotional, supportive, modest, and warm. These are qualities that we more naturally attach to women. In contrast, men are seen as being more agentic, and some of the adjectives we think of there: logical, independent, assertive, strong, bold, and decisive. So because of this division, we started to develop some of these stereotypes around what fits more with a woman and what fits more for a man. And it's interesting because even when we don't believe these things, when we look, you may look at that picture of the woman in the kitchen in the 1950s and say, well, that's not what I believe. I believe things should be equal, and it's not a woman's job to be in the kitchen and prepare the meals. But even despite your sort of explicit conscious beliefs, you may still have some of these underlying stereotype biases that drive your decision making. So an example would be, we know that women can be very effective pilots, and we also know that men can be very nurturing fathers. But still, despite those explicit beliefs, we have some of these implicit biases operating. And so by having these unconscious processes, these can, without us realizing it, drive our judgment and decision-making process. So this is an example. I don't know if anyone's seen this image, but it says, so you let your son play with dolls. Aren't you afraid he'll turn out to be? And then we can kind of question that, a good father, and kind of reframe that thought process differently. And that may clash with kind of our, initial instinct to say that doesn't fit with what I think is right. He shouldn't be playing with that. But we can kind of reframe that and think about it differently. So there's actually a way you can measure implicit bias. And I'm just curious how many of you, just maybe do a show of hands, have heard of the Harvard Implicit Association Test, or the IAT? Any of you? Okay. And then how many of you have actually taken it? Okay, yeah. So if you haven't taken the IAT, it's something I highly recommend that you do. And I'll walk through this test with you and kind of explain how it's structured. Here you can see in the image there are a whole variety of IATs. There are ones around gender and science, weapons, native, presidents, religion, age. So there's a whole host that you can take to look at how your biases, what your operating biases may be in these different categories. And the goal of this test is to measure the strength of the associations between concepts, for example, women, and evaluations like leader or stereotypes like helper. So to see how much do we sort of naturally connect these things. And the response will be easier when the closely related items share the same response key. And I'll show you what that means when we just bring it up. So here's an example. This is the gender science test. So the first task that you get when you go in to take the IAT for gender science has science on the left and liberal arts on the right. And so you line up your fingers. You're supposed to push the E key if something aligns with science, and the I key if it aligns with liberal arts. That's how the whole test is structured. So when you see philosophy, you would push I to align it with liberal arts. So it goes through a set of tasks. First, just getting you familiar with the task in the beginning. Then the second part is about the gender, so male and female, and then you align, you hit the E key if for man aligns with male, and then it'll present different words in that way. So then the third task actually pairs the concept, which is the science versus liberal arts, with the, in this case, evaluative is the gender, so the male and the female. So you'll see here that these concepts, the way they're paired, may more naturally align with some of the things we've already talked about in terms of our socialization experiences. So male or science, female or liberal arts, and then when you see the image, so in this case, or the word, you see physics, you want to push the E key because that should align with science. The next task is similar to the first, and the goal of this is to sort of take away the potential for practice effects, so you have a large number of trials in this fourth category. And then the last is where you actually pair the terms in contrast, more in contrast with one another, what we would expect to be in contrast. So male, liberal arts, female, science, and then you have to respond. So in this case with astronomy, you would choose the I key for science. And so the test actually bases its outcomes on the third and the fifth task. So it's looking to see what is your response time in the third task, which would be, I think I have this circled here, and the fifth task. So if you had some bias that aligned more naturally women with liberal arts, then you should have a quicker response time on the third task than you would on the fifth. And so you can look at your biases in that way, and it actually gives you a result. So you can see your this % bias. So we wanted to see, just kind of get a natural reaction from someone who'd never taken the IAT, just to see kind of how people feel when they get these results. So this is a doctoral candidate. Her name is Alicia Vos. She's in Dr. Ianessa Humbert's lab at University of Florida. And we had her take the Gender Career IAT. So here I have a little video of her reaction, which she loves. Hopefully you can hear it.
My bias, like I can feel it. You had this male, hard sciences, female, liberal arts, and like, and then you have to do female, hard sciences, male, liberal arts, and you can feel like how much harder it is. Like, you're like, you have to fight it, like that tendency. And I'm aware of it, and I'm still like, getting them wrong and like,
So when I took this, I was 97% biased against women in science. So essentially, I'm a woman in science studying women in science, and I'm biased against women in science. So go figure. Would love to not have to admit that. There have been some arguments against the IAT, some issues with it. So one of those is that you can't really separate implicit from explicit bias. You can measure explicit bias. There are ways to do that separately, so that there have been some studies that have looked at how explicit bias aligns with implicit bias, and there actually is a kind of a big difference in many cases. So people who do not exhibit explicit bias often still have those implicit biases. So you can't really separate them though in the actual IAT task. And the other issue is just sort of in the term implicit bias. So just by saying bias, we kind of assume that the judgments are wrong. So just as an example, let's say we had an IAT where you had to match children with first responder professions. This would not be a natural fit. And so you would be biased against children in first responder professions, and that would be appropriate. It's not a bias. So those are just kind of some arguments that have been brought up against the test, but it has been used quite extensively to measure implicit bias in a variety of studies and settings. So that's one thing I would say, to just take the time to go through and take the IAT and kind of see where you fall. And you may find that you have some biases that are stronger in certain areas than others, and that's just, I think, an important first step. So when we think about gender stereotypes, there are sort of three ways that they're represented. The first is in a descriptive way. So this is just sort of describing what the reality is. Men are overrepresented among doctoral degree recipients in CSD. The second would be prescriptive. So this is how it should be. Men are agentic, so they should strive for high status positions and awards. Women are communal, so they should occupy subordinate roles. And then proscriptive refers to what should not be, and the opposite of prescriptive. So women should not compete for high status awards or positions, and men should not be submissive. And you can see these stereotypes come out in these different ways in people who have these biases. So what are the possible ways that implicit bias could be influencing career advancement for female faculty in communication sciences? Well, the first I think we're all very aware of. CSD careers may attract more women due to perceived role congruity, and we'll talk about the concept of role congruity, but we all know that clearly there are more women in our field. So women feel a more natural fit with the field of communication sciences. But then once they enter the field, women may be subtly socialized away from and men socialized toward pursuing PhD degrees. And I think the word subtly is a key point here. It's probably unlikely that this is happening on an intentional level, that somebody's really trying to prevent women from pursuing PhDs, but more of these sort of implicit things. Implicit bias may favor men in the hiring and evaluation process. So as they're going to pursue a postdoctoral opportunity or a faculty position, there may be some favoring in terms of their fit with leadership. Women may suffer backlash for engaging in agentic behavior, such as self-promotion and adequately negotiating. There may be gender bias influencing the evaluations for research funding and awards that can disadvantage women. There's an assumed authority effect that may subtly socialize men towards leadership. So men are generally seen as being a better fit for authoritative positions, and so that may sort of route into the leadership position. And then even at the highest level, women leaders are vulnerable to stereotype threat, and we'll talk about what that means as well. So there are multiple ways that gender stereotypes can potentially influence this trajectory, and really the goal of our paper is to stimulate discussion, because we really do not have data to sort of support whether or not these factors that are at play in communication sciences. We can pull from other fields like nursing, occupational therapy, education, academic medicine that look very similar in terms of this disproportionate representation of men in leadership, and sort of apply some of that work to our field, but we really haven't looked at this within our field from a research perspective as of yet. So what do we mean by the term role congruity? This concept basically refers to the facilitation of men into occupation and roles that are dominated by men, and women into those that are dominated by women. So here's an example of some of the fields that are female dominated and probably naturally have more of a feel like they have more of a fit for women. So nursing, education, you can see one of the examples of speech language pathology that I pulled off of Google, and then early childhood education as well. And then in contrast, some of the fields that tend to be predominantly male, and some of this is shifting, which is encouraging, but there may be more of a natural fit in terms of that role congruity for men in these particular fields. So for individuals that are in a field that is predominantly one gender and they're the minority gender in that field, they can suffer from an implicit lack of fit, this sort of what we would term role incongruity. So here are some examples of men in female-dominated professions, and then of women in male-dominated professions. So even though they've gone into this profession, there's still that feeling that it's maybe you're not fitting in as naturally as you would if you were the other gender. And so I think this is an important point, because we often think about these operating implicit gender biases as negatively influencing women, but there are likely very negative effects on men in the field of communication sciences as well, in terms of really feeling a part of the field. And also there may be quite a few men in our field who didn't have the aspiration to go on into a leadership position, but maybe are sort of pushed in that direction or socialized that way when it wasn't something that was even an initial career ambition. So it can influence both genders. So this is an example. Not sure how many of you have seen this movie, but I think this really highlights this idea of role incongruity of a man in a female-dominated profession.
My sister Debbie. And her fiance, Dr. Bob.
Oh, you call me Bob. MD.
Actually, world famous plastic surgeon, Dr. Larry.
Oh, now cut that out. You know, Greg's in medicine too, man. Oh, really? What field? Nursing. No, really. What field? Nursing.
So hopefully most of us can check our responses and not respond in that way, but it just highlights how this can definitely be an issue for men in the field as well. So what about communication sciences and disorders? Well, we're finding, at least with these data that we've looked at, that this is consistent with other sex-segregated fields like nursing and occupational therapy. And we naturally have our mental image of the occupations of the occupants of a field has to do with the percentage of the gender in that field. So if 75% of job occupants are men, then we would associate those stereotypically male qualities, agentic qualities, with that field. So we would assume that in order to be an effective surgeon, you have to be logical and assertive and independent, all of those things that we naturally associate with men. And then in contrast, if the field is 75% women, we would associate more of those stereotypically female communal qualities. So if you're going to be a good speech-language pathologist, you have to be nurturing and helpful. So it sort of happens that just by the field being predominantly one gender, we start to associate those qualities with the field as a whole. So we also know there's one study looking at doctoral students in CSD and sort of getting their perceptions on the field and why they've decided to either be in the field or not. And communication sciences was perceived as lacking a scientific basis or prestige by many of the students. And when we look at the breakdown in terms of speech-language pathology and audiology, we find that we have a greater number of men in audiology than in speech-language pathology. And this may be, we know that science and high status career choices are more strongly linked with male stereotypes. So it may be that audiology has sort of a perception of being slightly higher status, having some stronger scientific basis, more objective measurements, and so we tend to see more men going that direction. And this may also be reflected in work setting, a healthcare setting versus a school setting. It's definitely something that we need to look at in more detail. But we know this to be true in the subspecialties of academic medicine, where we see more men in subspecialties that are considered higher status, like surgery, versus more women in pediatrics that would be considered maybe a lower status within the medical system. So it's also possible, as I mentioned, that we may have some subtle socialization of men toward and women away from pursuing PhDs. And this can happen really probably at any training level, undergraduate, master's program, and it may be in ways that we interact with our students that we don't even realize sort of the messages that we're giving based on these biases. So this is a study that looked at dean's letters for medical students. And you can imagine this could be applied to CSD in terms of recommendation letters for research training or a healthcare setting versus a school setting. And they gathered all of the letters that the deans had across a variety of institutions had written for the medical students going into residency, for both women and for men. And they found that in the letters from the dean, women were more commonly recommended for family medicine specialties, internal medicine, pediatrics, as compared to men who are more commonly recommended for surgical subspecialties. So even in the recommendation letters that we write, the messaging that we give and the way we describe applicants can be really influential in how they're perceived and what direction they end up going. This was a survey of communication sciences and disorders graduate students, looking at men and women, men in green, women in blue. It looks like pretty similar in terms of the number that have considered a PhD at some point. They were also asked to rate their likelihood of entering a PhD program within the next 10 years. And we see that just slightly more men, less than 50%, but more women at greater than 50%, and pretty even at greater than 75%. So still not a big difference in terms of those thinking, yeah, I think I want to pursue a research doctoral degree in the future. In terms of a clinical doctorate, it's also pretty comparable between men and women. And then they also asked this question about whether or not they perceived the other gender to be treated differently in the field, and found that 37% of men felt they were treated differently versus 31% of women. But then they went on to ask, of those who felt they were treated differently, how many males believe they were treated differently compared to females, and how many females believe they were treated differently compared to men. And so a higher proportion of men felt they were treated better in the field, and a higher proportion of women felt they were treated worse. And then more women just sort of described this as being treated differently, so didn't give it a better or a worse. So I think these are really interesting findings that sort of support this idea of subtle socialization, that there are, the students are perceiving different interactions from faculty in terms of how they're treated, but we still don't really know what's meant by better or worse. So this is something that we definitely need to delve into more. So the next sort of tier on our pyramid is this idea that men could potentially be favored in the hiring and evaluation processes. So I don't know how many of you are familiar with the Goldberg design. It's been used in many studies looking at gender across a lot of fields, but the basic idea is that they'll create applications for a male and a female candidate, and the applications will be essentially equal weighting in terms of the applicant's qualifications and the descriptions of the candidate. All that will be different is the name. So in this case, John McKay versus Joan McKay. So just having more of a gendered name. And when they've looked at the sort of outcome of these applications or credentials being reviewed with just this difference based on name, the women are perceived and rated lower, perceived to have less competency just based on that difference in name, with everything else balanced. And so this has been used in a lot of different settings, but this also sort of supports this idea that when you're being evaluated for a job or for career advancement, just having a female sounding name could be a trigger for some of these stereotypes. Another study looked at performance evaluations of women managers, of female managers, and found that generally they were rated or perceived more favorably compared to women in general. So being in some kind of leadership position, they were kind of that bump a little bit higher than the general population, but compared to male managers, rated and perceived less favorably. So again, just sort of highlighting as we advance and even kind of move, even if we're not subtly socialized away from research doctorates, once we're on that pathway, the actual evaluation of the performance could be influenced by some of these stereotypes. So what are some of the influences on the devaluation of a woman's performance? One of the things to think about, if this is something that you feel could be operating and something that you want to address, is avoiding ambiguity in evaluation criteria. So you can imagine that if it's not clear how the candidate is supposed to be evaluated, that leaves more room for falling back on those biases that we all have operating subconsciously. So it just gives a little bit more leeway for people to kind of fall back on those things rather than having to stick to the strict criteria and say, oh, she actually does have a comparable number of publications, or she has published in high-tier journals, and just having those clear things that need to be reviewed. Another thing is lack of structure in the evaluation process. So not even just in the evaluation criteria, but just not having a clear set of steps that you would go through in terms of who gets invited for an interview or what are the next steps following that. So just being really clear on what that evaluation process is and using that consistently across candidates. And then also this idea of denying credit to women for successes. So this is seen quite a bit, even when a woman has certain achievements, sometimes those achievements can be attributed to sort of other things like being in the right place at the right time or having a male collaborator. So some of that can happen as well. So then we can also think about women who engage in agentic behaviors, and I'm sure many of you know women like this, where their behavior naturally violates gender roles. So these sort of this role congruity that we talked about, their behavior creates a role incongruity. So when we're interacting with them, how they're behaving isn't consistent with what we might expect based on their gender. So I'm sure many of you have seen this quote from Sheryl Sandberg: "I want every little girl who's told she's bossy to be told instead that she has leadership skills." So if we even think about the term bossy and how that's really something that we only apply to women most of the time, and what that might be reframed as in terms of being a leader. So this is an example.
I actually think the terms of your incompetence do not interest me.
So if we think of this, the Devil Wears Prada, as an example of a woman who behaves in these agentic ways, right? Agentic mannerisms, is really penalized for that. And even at the end of the movie, it's portrayed that she ends up really unhappy, and that these behaviors were not working for her. So this can definitely be an issue, even when, I'm sure you've all heard this idea of, well, I need to sort of behave then like a man behaves in this setting so that I can accomplish the same things, that actually can have the reverse effect and cause there to be backlash because it isn't congruent with what the expectations are based on gender. This was a study conducted by my colleague Christine Kolamainen, who's also a co-author on our paper. Christine is a women's health physician, internal medicine physician, and she was interested in what the reactions were by women physicians that were leading cardiopulmonary resuscitation. So talk about a situation where you have to be really taking charge, have leadership skills, be extremely assertive and independent in leading that code and that resuscitation. And it was really interesting because, so she did qualitative interviews, semi-structured interviews with the physicians after they led the code to see how the men felt about having to take on more of that sort of agentic behavior versus women, and also interviewed those that interacted with the women and the men during the code to see what the perceptions were. And the women were more frequently perceived as being bossy, and the female physicians also expressed concern about how their behavior was being perceived by others running the code, whereas the male physicians didn't express that same level of concern. So again, just highlighting, when you have to behave in a way that is sort of incongruent with what's expected, that can also create anxiety for women as well. So then in terms of thinking about the evaluation of gender bias and its influence on research funding and awards, there has been quite a bit of research looking at the different grant levels. So if we look at the postdoctoral training levels, the institutional training grants, and the F32 grants, and then we look at those for the mentored awards, like the K Award series that you can see here, we know that there are equal number of men and women that apply for these early career K Awards. However, when we move a little further up the funding ladder to the R03, R01, and R21 levels, there are fewer women that successfully make that K to R transition, and even when they do submit, they have lower success rates for their R01 renewals. So seeing this sort of fall off as we move, again, highlighting as we move up the ladder in terms of funding, we see women start to fall off. And then we can think about this concept of authority effect. So why might it be that we see disproportionate representation of men in leadership roles like department chair positions, full professor, tenure professor? Well, we know that there's more of a role congruity for men that are in high status and leadership roles, because the qualities that would be assumed to go along with those leadership roles are more typically stereotyped male qualities like logical, assertive, independent, leader. And there's also implicit assumptions that operate that occupational roles predominantly performed by men are more valuable. So that's why the subfields or the careers that are predominantly male tend to be seen as being more higher status in our society. So what about the authority effect operating in communication sciences? Well, we know that this affects other female-dominated fields like nursing, OT. It's been looked at in the library science field and in education. And our data support that this could potentially be operating. What's interesting is that even with the diminished pipeline of potential leaders, if a sufficient number of men earning their PhDs entered the CSC field, we could replenish the ranks at all levels, right? So if we had enough men come into our field, they could just rise up into the leadership positions and fill all the faculty vacancies and our problem would be done. However, that's not the case. And there are 2 men to fill these vacancies, which is potentially why we continue to see these shortages over time. And I'm not sure how many of you are familiar with the concept of stereotype threats, but even when women move into leadership positions, this is something that they deal with on a regular basis. So this is anxiety or fear that performance on a difficult task will confirm a negative stereotype about their group. So one of the studies that I really like was a study of undergraduate students that were taking a math test, and they had females and males. So first they had a situation where it was just females with other female, or females with males taking the test, and then they had a situation where it was females with only other females taking the test. And the females performed better when they were in a group of all women versus when it was a mixed group. Sort of this idea of I've been socialized to believe I don't perform as well on a math task, and when I'm in the company of men, my performance is affected by that. So we know that in these situations, it's common to feel heightened physiological stress responses that can actually impair prefrontal processing. It's a tendency to actively monitor your performance, so you're very concerned that you're going to confirm a negative stereotype, so you're constantly questioning and thinking about what you're doing. And then kind of in conjunction with that, you're trying to suppress any negative thoughts that you have about how you're behaving and whether or not that's confirming a stereotype. So a lot of cognitive processing going on around avoiding confirmation of a stereotype that could potentially affect performance. But despite this, the studies that look at leadership style of men and women show that women are still very effective leaders. So it doesn't seem that it's really having an effect on the ultimate performance, but it's certainly creating a lot of stress for women in those circumstances. So then, of course, as we're pulling all of this literature together, we know that there are other factors that contribute to the faculty shortage. So it certainly can't only be the effects of implicit gender bias. And the Joint Ad Hoc Committee did look at this, did reach out to the CSC programs to find out what some of the issues were that faculty in those programs thought might be playing into the faculty shortage. And the top 2 factors were funding and also this idea of low quality applicants. So just not having applicants that kind of meet the bar. We saw 2 categories of factors. One were academic factors, so limited research opportunities, insufficient faculty mentor availability, limited funding, and low quality applicants. And then also personal factors, so geography with respect to the CSD doctoral programs, maybe the program or the mentor that you want to work with is across the country, so that's a barrier. Life circumstances, maybe they're unable or unwilling to relocate, and also family commitment. So certainly all of this plays into the decision to pursue doctoral training. And then the potential influence of salary. So we saw that there is that salary gap, and then we also talked about that today in my meeting with faculty about whether or not just our salary levels, could be kind of a factor that plays into this. But one of the issues that I think came to mind when I was reading through this list is there's still a potential influence of implicit gender bias in some of these factors. So when we look at how do you define a low quality applicant, right? And when we're talking about ambiguity in evaluation criteria, if it's just high, medium, and low, it's like, how do you define that? And if, many female applicants are applying, it could be that there's some bias operating in terms of those applicants being lower quality. So it's hard to know how much bias actually plays into some of these factors that have been mentioned by ASHA. So then it's also important to consider the intersection of other factors with gender. One of the things that we looked at in terms of the literature is the intersection of race and gender. the majority of research in this field has focused on the impact of gender stereotypes on women's career advancement for white women specifically, and not really delving into how this might influence Black women. We know that the non-white racial composition of ASHA is 14.5% versus of PhD, those who have a PhD, versus 7.9% of the total population in CSD. We know that white women are rated more negatively for agentic behaviors than Black women. Black but not white men are penalized for agentic behaviors. So it's actually that Black women are maybe expected, or there's a stereotype that they would be more naturally agentic or have more of these male qualities in terms of interactions. But then it's the opposite for Black men. However, Black women will suffer from stereotyped assumptions of lower competence for gender and for race. So this idea of competency bias, that someone of a stereotype group will be less competent when you have both gender and race, then you're being penalized for both of those pieces in terms of competency. So this leads to the next steps, and it's important to understand that these implicit biases operate, that we all have them, that they could potentially influence our decision making if we're not aware, but it doesn't really take us anywhere. Then the next question is, well, if this is true, then what can we do about it, if anything? So as I mentioned, the goal of our paper was to initiate dialogue within communication sciences regarding the role of implicit bias in female faculty advancement, but we need objective data to target potential interventions. So we need to know, are these biases operating? At what level? Is it at a training level, undergraduate, master's? Is it operating within PhD programs? What is the perception of faculty? So objective data is number one. And I personally think it's really important that we start to have discussions with students about what their experience is and what their perceptions are around these issues. And so we're hoping to design some qualitative studies to begin to delve into some of this a bit more. And I'm just making the point here again that while the numbers are fairly comparable in terms of the desire to pursue PhD training or a clinical doctorate, men are still overrepresented for pursuing and obtaining a PhD. So even though we see that sort of equal desire, something is happening along the way that's discouraging women from going that route. We can also think about the messaging in our field and sort of how we're presenting our field to potential students and how we're presenting research to undergraduate and graduate students. So this may seem a little counterintuitive. I mean, ideally, we would like to see the stereotypes sort of eliminated. That's likely not going to happen, considering that it's still a very common socialization experience for most of us. So one of the things we can do is actually describe doctoral work with more communal terms and aspects to make there be sort of more of a natural fit for women thinking about pursuing research doctoral degrees. Some things that we can talk about are the ability to mentor others, the ability to improve human health, the integration of career and family. And so by having discussions around these aspects of pursuing doctoral training and having an academic faculty position, those may be pieces that are more congruent for female students considering that career track rather than leading an independent research program, you know, the sort of emphasis on the hard science and the independence of it, but rather how we can emphasize giving back and mentoring will be more consistent with what females sort of identify with. We can also consider subtle environmental messages in the rooms where students are training or in interview rooms. So what are the images that we have up of speech-language pathologists working with students? What does that look like? How do we message that to students? And then also thinking about recruitment materials and making sure that we have equal representation of men practicing clinically and women in high status leadership positions on those recruitment materials so that when someone's looking at that and thinking this might be a good fit, they can see themselves in that role. And then avoiding ambiguous criteria for acceptance and promotion. So having quantifiable objective outcomes that can be tracked, a structured process and timeline for promotion. So it's very clear what those steps are and what you need to meet. It's very objective, so it sort of avoids leaning on those stereotypes. And And I just thought this was a good example. There are some studies that have looked at orchestras and how they've adopted blind auditions just to avoid this issue of bias. If you think about The Voice, just assessing it based on the quality of the voice rather than on what the person looks like or their gender or other qualities. And then I also just wanted to mention some bias training workshops that have been developed for faculty. So it's important to understand that implicit bias is a remediable habit. It's something we can actually address and take under control. There was a cluster randomized trial of 92 departments. The departments received a 2.5-hour bias literacy training workshop where they talked about applying principles of behavior change, and I'll get into what these principles were a bit more. But they found that the intervention sites had greater awareness of their personal bias after the bias literacy training, motivation and self-efficacy to engage in gender equity behaviors, action to reduce gender bias on a regular basis, and a greater percentage of women as new hires 2 to 3 years after the training. So definitely some positive, very positive outcomes from just a short bias literacy workshop. So I recently actually underwent this bias reduction in internal medicine, or BRIM, training workshop. And this is a randomized controlled trial being conducted by Molly Carnes, my colleague and senior author on the paper, looking at specifically at internal medicine departments and whether these bias literacy workshops can have a positive impact. And some of the things that were discussed in this workshop around these principles of behavior change. So the first is to recognize, label, and challenge stereotypes. So we talked quite a bit in the workshop, what is expectancy bias? When you see someone of a particular stereotype, what do you expect their behaviors to be? What is competency bias? That you assume someone of a stereotyped group is less competent. And then reconstructing credentials. So that's that ambiguity and evaluation criteria where we kind of sort of construct the credentials according to what we would expect for that stereotyped group. So just being able to label the different kinds of biases and the actions that are taken based on those biases is a really important first step. And then reciting a growth mindset and internal motivation messages for change. So an example, the vast majority of people are working hard to overcome the influence of stereotypes, and it can be achieved. Sort of having those internal messages that you're giving to yourself. Individuate and perceive variability. So within any group, there are multiple subgroups. So you can't just assume that because someone is of a stereotype group, they're going to behave like everyone in the group. So just kind of recognizing that and being aware of the variability. Practicing perspective taking. So imagining that you're someone of that stereotype group, you're a woman in a room of all men, how that would feel, and putting yourself in that position and kind of walking through that experience for that individual can be really helpful to encourage empathy and a desire to actually change your behavior. And then acting to combat microaggressions. So some of these, when we say microaggressions, I think years ago it was more common that some of these biases would be explicit. People would just say wildly inappropriate things, and it was sort of ignored or acceptable. Now that's much less the case, but that doesn't mean that there can't still be subtle behaviors that are termed microaggressions that people can take against others that are much less obvious to the rest of us. So status leveling refers to kind of putting everyone of a stereotype group at the same status level. Failure to differentiate, so let's say there's 2 female faculty in the department and you constantly call them the wrong name, right? Like, oh, you're essentially the same person, so it doesn't matter what name I call you. Attribution error, so giving credit to the wrong person for what they've accomplished, and invalidation, so essentially invalidating someone's accomplishments because they are of a stereotype group. So understanding and labeling what these microaggressions are, and then in the workshop you actually walk through scenarios where these microaggressions take place and label what they are and talk about why they're problematic. I also think another area that we can target are educational interventions for students. So one of the things that's been shown to be really helpful in encouraging female leadership qualities is actually having a course on women's leadership and self-efficacy. So you can imagine that if those stereotype qualities aren't consistent with leadership, then naturally women would be less likely to think that they're the right fit for a leadership position, or that they're able to be in that position and actually operate effectively. So gaining skills in leadership, self-efficacy, personal mastery, and self-esteem. And actually ASHA has a leadership academy that already exists that you can go through. And it didn't seem, from just reviewing what I could sort of gather, I haven't gone through it myself, I don't know if any of you have, that there's any focus on these sort of female or gender issues related to leadership self-efficacy. So having that be a component of the Leadership Academy and leadership training programs, and even implementing some of this at the undergraduate and graduate level, I think could have a big impact. So in conclusion, awareness is the first step. If we can see that, acknowledge that these biases are operating, understand them, realize that they're not specific to one gender, they operate for everyone. We need to gather and share data to elucidate the extent of the problem. We have evidence-based approaches that we can implement that have been proven in studies, but we need to be able to critically examine the processes and practices at all career levels in CSD, so we definitely need more research in this area. And I'd also, I know I've mentioned names throughout the talk, but it's really important. I want to acknowledge my co-authors, Dr. Ianessa Humbert, Dr. Molly Carnes, and Dr. Christine Kolamainen, and also the Center for Women's Health Research at University of Wisconsin-Madison. And with that, I'm really looking forward to the discussion and any questions that you have.
So much. What we usually do is we take questions from the room first. If you don't mind, if the questions from, especially if it's from the back of the room, if you can summarize the question for the online folks, because they only have your mic there. Absolutely. And then we have questions from online, which I will read out to you.
Okay, sounds great.
So, with regards to attitudes of men and women when deciding whether to get into ComD, do they differ regardless of whether they're planning to get a PhD? So the reasons why a man wants to get into ComD, are they different than the women?
So the question is, do the perceptions of pursuing a career in CSD vary between men and women regardless of whether they want to get a PhD, just whether they would like to enter the field? Yeah. That was the goal, I think, to examine of the study, where they looked at this sort of status level, the perceived status level of CSD from the undergraduate students, was to kind of get at some of those questions. Unfortunately, that's the only study that's really looked at gender as a factor in terms of how CSD is perceived. In that study, men did see CSD as being a lower status field than women. And it's probably because of the perceived role incongruity, that the images that you see when you Google speech-language pathology are very consistent with the communal, helpful, nurturing aspects of the field, which are great, but there might just be sort of a perceived lack of fit for men that are looking at that. But that's the only study that I know of that's actually looked at the undergraduate level and kind of making the decision of whether to go into CSD. So we definitely need to design some studies to look at that. And I did just want to add, I mentioned this just in some of the discussions earlier. We're certainly not saying that we don't want to sort of pull more men into the field overall. It can only be beneficial for the field to have more men in the field and represented. But at the same time, we have to look at these sort of advancement issues of women in the field. They're not mutually exclusive. They both need to happen at the same time. And then we also just have to be aware that if we pull more men into the field, there may be more of a routing of those men to PhD programs and leadership positions. So it has to be a very conscious process where we're pulling men in, but we're making sure that we're also advancing women.
I appreciate that you talked about mentoring students, because I feel like the majority of our students come in not thinking of themselves in leadership roles. Mm-hmm. So I think about why I went on to get a PhD, it was because a female chair planted the seed. And I feel like we need to do a better
better job of planting those seeds and saying, you know, whether it's going on for your doctorate or just thinking about being in a leadership role, no matter what setting you go into, I feel like maybe that's something that we could do more of.
So the comment is that we don't maybe spend enough time working with students on their view of themselves as leaders and their ability to give back and mentor others as they sort of progress. Yeah, I completely agree. I think that's a huge factor. When you think about the way that a research career is described, many of the qualities and descriptors that we use are very consistent with male qualities. Ability to obtain independent funding. A great example of this, I don't know how many of you have heard of the NIH Pioneer Award. It's a leadership award for highly innovative projects. And I actually think it's a substantial amount of funding over sort of a short timeline, so it's a very prestigious award. When they initially put out the announcement for the NIH Pioneer Awards, they used the term risk-taking. We want someone who takes risks. And this was really, it was weaved throughout the description of the award. And that year, maybe it wasn't zero, but it was a very low number of female applicants, and no Pioneer awardees were female. The following year, they changed the language and the messaging and took out a lot of the reference to risk-taking, and they had a substantial number of women apply and receive the award. So the way we talk about things and describe the roles that a particular position requires, I think can be a huge factor, but then also encouraging leadership opportunities, so even allowing graduate students to mentor undergraduates and develop advocacy around that, doctoral students mentoring graduate students and so on, and then commenting on that, even using that as part of our evaluation for students, I think could be really effective too.
Thinking about advancement and women kind of going up the academic ladder, is there data on how much it's women leaving or just kind of staying in the same maybe rank? Do you have information on that either in CSD or in other fields?
Yeah, that's a great question. So in CSD, we can't piece it apart. They're just overall numbers kind of at each level, so we know how many enter doctoral programs and how many finish, but we have no idea whether they're actually the same people. So that's something that I think is a future direction, or maybe just a shift in the way that we're sort of collecting the data. In terms of other fields, like academic medicine more broadly, you can see that just sort of in the funding trajectory in terms of women kind of falling off in those later career stages. I don't think it's really been examined, at least from what I've looked at, as to what the reasons for that are. Certainly some of it has to do with the evaluation by others, like the grant reviewers, in terms of rating, giving lower scores to women for some of these reasons that we've talked about, but something that definitely needs to be looked at more.
Is there research from any other field that would suggest, like, you talked about how these biases operate in other disciplines, but is there an example discipline where they worked and like shown improvement and like something that we can learn from it?
Yeah, so the question is, are there examples from other fields of how they've effectively addressed some of these issues and how we can learn from it? I think that the work that Dr. Carnes has done in the field specifically of internal medicine is a really great example. So since she's been implementing some of these strategies, like so our tenure criteria are very, very clear and highly objective. It's very clear what those steps are for promotion. The evaluation criteria is not ambiguous at all. She's seen a great increase in the number of female faculty, research faculty in internal medicine. So I think that's a good example. I don't know much about, I haven't seen much in the nursing literature in terms of interventions that have had a positive effect. But I think in the world of academic medicine, there's been a lot more focus on interventions with a lot of success. So it seems that if you apply some of these principles and also talk about these bias literacy issues, there is a positive impact in terms of the number of women that are in those leadership positions.
Can I ask a follow-up question?
Of course, yeah.
So you talked about having really objective promotion and tenure criteria, and our college has actually been revising their criteria. So I'm just interested in, you talked about, like, if the expectation is based on a bar that was set predominantly by men, and then even though it's very objective, has anyone looked at that? So it's a very objective bar, but the average was set based on averages achieved by men.
Yeah, that's a great question. So the question is, if you set the tenure criteria from a male perspective or a male experience, could that have an influence?
So some of the communal things aren't represented in our tenure promotion criteria.
Yeah.
That's not going to be, it may be great for attracting people to get a PhD, but it's not going to get them to be successful getting tenure under our current criteria.
Yeah, I think that's a great point. I don't know that there have been well-designed studies that have looked at, okay, if your committee is composed primarily of men and the criteria are set out this way versus if we integrate women. But I do think that I think there's a lot of literature showing that the more diversity you have in terms of perspectives, the more that sort of the outcome represents the group more effectively. So yeah, I definitely think that's a great point. One of the things that we have in our School of Medicine and Public Health, and I don't know if this is common, is we do have a pretty strong emphasis on service, which you might think of as being more of a communal, sort of female quality, but it's even to the point where we can actually go up for promotion and research and services are primary areas. So I think that, yeah, there are some shifts that have happened in that way, but it's a great point. If you have one perspective, then your criteria likely wouldn't apply across the board. And then the other piece I was going to say is that in terms of tenure extensions, I think that's also a big piece as well. So whether the university has a policy that allows for women to be on leave or to be gone, and then also applying that to men equally so that you also can have that extension if you're a man. I think those are important pieces. But yeah, I don't know of any studies that have specifically looked at the makeup of the tenure committee and whether that has an influence on outcomes. It's a great question.
We have a question online from Ainsley Smith. With data showing an apparent income-gender gap in the field, how can corporations and institutions continue to validate paying highly qualified women a lesser salary? So how is it possible that they're still able to get away with this?
So the question is, how is the salary gap continue to be justified? This paper and the work that we've done here is the first time I've ever seen the salary gap even discussed. So I guess I'm not sure that it's really widely recognized and understood that this exists. Again, it's really at the full professor level, but I'm hoping that this stimulates discussion and allows people to sort of reevaluate their own decision-making about salary. But yeah, I don't know that there's really been a discussion in our field about this issue before this. I haven't seen anything.
Piggybacking off that question, there's been a discussion in the broader literature, especially in economics, about the gap, and that it's specifically related to childcare. That it's really families when they have children, that's when the gap sort of shows up. Do you have a sense, given that it's a full professors, that that's what's going on here, or do you think there's a different mechanism?
Yeah, so the question is the salary gap related to childcare expenses for women versus men? I do sort of question that though, because it seems that the childcare expenses would sort of impact the salary.
It's just having children. So women who don't have children don't see the gap.
Got it. We were
right. Sorry. Yeah.
Okay.
So that you might think that might be.
Yeah.
So I was wondering if you think that that's a similar mechanism for why, say, we're only seeing this in the full professor level. You know, that later, given that maybe people are delaying childcare. Just do you have a sense of that, or do you know? Is there any data?
I think it's a great point. I don't know of any data specific to CSD, but I wouldn't assume that it's not a factor just because the gap's at the full professor level, because certainly if you think about the other responsibilities that could potentially impact your career trajectory and level of accomplishment up to that full professor level, it's possible that if you have a family, that could potentially influence your productivity in some way. As compared to someone who maybe doesn't have children. But yeah, it's not something that we've looked at in this field at all. I think it's a great question. Yeah. And that may be where some of the discussion around tenure criteria and what we're looking at in terms of accomplishment probably needs to be reevaluated to some extent.
So you showed a bar graph looking at the ratio of men to women at the different levels of the tenure track.
Yes.
So assistant, associate, full.
Yes.
Has that ratio changed over the years, or is this kind of set?
So these are data from really very recent. Trying to think, I'm not sure that these data go back far enough to look at trends over a number of years. I believe it would maybe only be as far back as like 2010 in terms of by rank, because there was at one point a shift where they weren't separating out these data by gender, and then they started doing that. And I'm trying to think of, there actually is an interactive graph where you can change all of these variables and look at faculty rank and gender and race and all of these pieces, but it doesn't go back far enough for us to really see whether there's sort of a large trend in terms of that shifting over time. I think that's a great question.
Yeah, the reason why I ask is because, if I'm saying this correctly, so there are fewer, the ratio of women to men is increasing as they enter university in general. For example, here at the University of South Carolina, it's 55% women, 45% men. And that's actually keeps on increasing. So maybe you'll just take care of the gender gap. There won't be any men at the university then.
So I'll put this up so you can see. So the question is, given that the proportion of women is increasing in general, pursuing college level degrees, that maybe will take care of itself. Unfortunately,
I don't mean that seriously.
Unfortunately, I don't think that's going to address it. So a great example would be, and I'm not sure if I'm going to have the exact year correct, but there was a shift in the field of medicine where there was a lower proportion of women to essentially equity between the number of men and women that were entering medical schools, and that's been in place for some time now. I want to say maybe even the mid-80s, but we're still seeing these issues with advancement in the world of academic medicine. So it is interesting in terms of how we're sort of socializing and routing women to pursue college level degrees, but then even once they get to that point, sort of these biases are still operating at that higher level in terms of what the trajectories look like. So I don't think that just increasing the number of women will. But I'd like to see those numbers encouraging.
No other questions online. Does that mean, do we have a separate session after?
No, we're good.
Okay,
We're good.
great. Thank you so much.
Thank you so much.